Okay, good morning, good evening, good night, doctors, nurses, and pharmacists. I'm Dr. Che, and today we will discuss some important reading tips. Okay, if you can share this session with other doctors, nurses, and pharmacists, that would be great. Okay, so just let me start. And okay, good evening, good morning, all of you. So let us start. Okay. Okay, so thank you. So, okay, so let us start. First, we will discuss letter because I have received more than 30 letters, 30 letters almost. Okay, so it is not possible for me to mark all of them. We will try as many as I can. Okay, but it is not possible to mark all of them. Okay, so but we will discuss the case notes. We will write the letter. I will just teach the important things in this letter. Okay, and then we can discuss your letters if we have time at the end. Okay, so people on Facebook, I'm also seeing your comments. Okay, I can see Samuel Ma and Potab Naskar. So sorry for wrong pronunciation. So I can see your comments. If you have any questions at any time, if you want to participate on Facebook, you can also write in the comments. People on Zoom, if you want to talk with me, you can unmute yourself. You can talk with me. Otherwise, you can write in the chat also. Okay, so this is these are the case notes I just wrote yesterday. So I have not revised them again. Okay, there might be some mistakes. Okay, there might be some mistakes. So once I write this letter again, then I pick the mistakes and then we can correct them. But overall, I have tried to be as accurate as I could. Okay, so but there can be some mistake. Okay, don't worry. Okay, the main thing of writing this letter is as it is for both nurses and doctors, because most of you are nurses and some of you are doctors. Okay, so can any nurse talk with me? Any nurse, please? Any
Yes, sir.
nurse?
Yes, sir.
Okay, okay. So both of you can participate. Okay. So
All right.
in the real exam, so just to be aware that this is my own, these are my own case notes, not anybody else copyright. So this is the reading time. This is in the real exam, how much time you will get to read the case notes?
It's 5 minutes.
5 minutes.
In 5 minutes. Very good. Can you write anything and underline the case notes in 5 minutes?
No, no. No, we are
No,
not
sir.
supposed to write.
No, not at all. Even you cannot pick the
No,
Pencil.
you cannot
pencil.
use pen and
Cannot
pencil.
even pick the pencil. Okay, pencil down, and everybody is just reading. Okay, and then we have 40 minutes to write. In this time, you can underline your case notes, you can tick mark, you can cross, but you can do whatever you want. Okay, but please, please, never ever write on the blank page. Means you have in the real exam an answer sheet will have four pages. Okay, just like this is one page. First one would be just to write your name, your signature, and your picture and these things. Next page would be lined one, mean there would be lines. Then the next one would be also with lines. So page number 2 and 3 would be with line. And page number 4 would be blank page. Okay, blank page. Never write your main letter on the blank page. Blank page is just to use for rough use. Okay, you can plan, you can write any notes there, but your main letter would be on the paper that would be with lines. Believe me, I had one of my students in the last year. He wrote his letter on the blank page. Okay, then the examiner noticed this, means vigilator noticed this, and they told to remove the letter from that page and to write on the lined page. But he had no time. He had no time to transfer his letter from the blank page to the other page that had lines. So please be careful with this in the real exam. Okay. Okay. So now just imagine, we have 5 minutes reading time. Okay. So you are a doctor or nurse at Newton. Why I'm writing these letters for both of you, so that we can practice how to write, because I cannot take separate classes for doctor and nurse. So I'm just trying so that both of you can practice. Okay. You are a doctor or nurse at Newton Family Clinic. Read the case notes below and complete the writing task which follows. Okay. So after that, where we should go?
Writing task.
Writing task.
Writing task. Very good. Very good. Writing task. Okay. So in the writing task, it says, using the information in the case notes, write a letter to clinical psychiatrist DrChe for further investigations and treatment plan. So this is the name of the reader, DrChe, clinical psychologist, psychiatrist, Greenfield Hospital, 555 means you will get 5 in each module. This is why I read. English Expert Street, Manchester. Okay, this is my WhatsApp number, my original WhatsApp number. Okay. So these things will be same in every letter. You don't need to write. Okay, you don't need to read. Okay. Okay. So done with. What do you think in this writing task? Which kind of letter you are writing?
Referral.
It's a
Referral
transfer
letter.
letter. The transfer letter.
So we cannot say like transfer. We can also say, but mainly it is a referral letter. Okay. You can also say transfer letter, but the main thing is a referral letter. Okay, you are referring patient from
Because
one
we are
place.
referring patient from our clinic to psychiatric.
Yeah, your clinic to scatter. People on Facebook, you can just write something in the chat also. I will read it. Okay, don't worry. I'm also watching. You are seeing your comments. Okay. So we have 80 people with us on Zoom and 20 on Facebook. So first time we have 100 people with us almost. So 20 on Facebook, 80 with me on Zoom. So I will try to teach as much as I can. Okay. So now before we go to read, okay, just quickly let us read here. Okay. So you are this family clinic means you are at GP level. Okay. Family clinic. Okay. So this is the name of the patient, Joshua Martin. This is my own invention. Okay. This is the date of birth. This is the address. This is the social history. Let us not read social history because first we need to take overview of the letter. Okay. Just married, children. Okay. So employment, works in NHS, manager. Okay. Hobbies, then smoking, then, drinking. I'm not, I'm thinking like, okay. So just I'm thinking like I'm the real exam, what I will do in the real exam. Okay. Quickly. Okay. I will read these things. Just I need to know what is here in this heading. Okay. He is living alone, isolated, neighbors, mates, top middle. Okay. Then his family history, wife, Anna Malkova, 70 years. So all of these heart diseases. Then his personal history, hypertension, COVID, bunectomy, all of these things. Okay. Then what we need to see? After social history, past medical history, family history, what we need to see?
Present
Visits.
What?
Visit.
Patient last visit.
Last visit. Well, last visit, first visit, what we need to see?
Last.
Visit.
Okay,
Last
guys on
visit.
Facebook, people on Facebook, what we should see? Facebook people, please write in the chat. So what we should see? Complaints?
yes, current complaints.
Current complaints? No, I want to listen something else. I want to listen something else.
Today's visit.
Today's visit.
Condition stable or unstable?
No, not at all.
Reason for the visit.
What?
The reason for the visit.
No, not at all.
Last visit.
Not at all. After you have just quickly gone through.
Plan. I mean plan.
Not at all. So social plan we can see after reading the writing task. You can see the plan. Okay, this is a good thing.
Purpose.
After you read the task, you can see the plan. Okay, because in the plan there are very important things like assessment. Okay, diagnosis and these things. Very good. Who is Somia Santosh? You're a doctor or nurse? You're a doctor or nurse on Facebook, Somia. This is what I wanted to hear, what Dr. Somia has told us. Maybe Dr. Somia or not Somia, Miss Somia. So you need to see the dates. Before you go into detail of each visit, see the dates because dates are very important. If there is one visit about 6 months ago, you become suspicious. It is important or not. Okay. So it's very important to see the dates before you read what is in each visit. Okay. So let us read here. This is 16th of August, 2022. Next date is 23. And next date is 3rd of September 2022. This is today's date. Okay. By the way, I have written these case notes in the morning before I went to sleep. Okay. So this is the original date when I've written these notes. Okay. Case notes. Okay. So which dates we have? 16, 23 of August and 3rd of September. 3 visits. Okay. So before we go into each date, let us see the plan. So in the plan, we have to administer this medication, those 2 medication. Call 99 ambulance, transfer patient to psychiatry department immediately. Inform paramedics about suicidal thoughts. Inform patient's wife about his current condition, and assessment is depressive psychosis. So there are many important things. Just when you need to talk, then you can unmute. Otherwise, please mute. Okay, please mute, all of you. Just when you need to talk with me, unmute. Otherwise, keep your mics muted, please. Otherwise, I will mute all of you and you will not be able to unmute because I have this control. Okay. So then you will not be able to unmute. Just who wants to talk with me, mute yourself, talk with me, and then mute again. Okay, please. Okay. So we have plan here. That is very important. The plan. Okay. Now let us go to the. So what is our main diagnosis? What is our diagnosis?
Depressive psychosis.
Depressive psychosis. Very good. Okay. So now let us go to first visit. On 16th of August, patient presents to GP.
Depressive psychosis.
Yeah. Okay. So now this visit, patient comes to GP with fever. Okay. Burning sensation while passing urine, dysuria. Okay. So he was doing urine more than normal, means frequency, waking up at night to urinate nocturia. Also mentions foul smelling urine. Examination, this is BP, this is pulse, this is saturation, this is temperature. This is respiratory rate. Urine dipstick is positive for leukocytes plus protein. UTI was diagnosed and prescribed trimethoprim 1 gram daily for 3 days. Okay. Now we have next visit on 23rd of August. Urinary symptoms improved, feeling low as living alone at home, isolation, wants to visit his wife at care home. Was admitted, she means his wife, okay, was admitted at care home 2 months ago due to deteriorating dementia. He finds difficult to manage, to manage or to do, okay, something. Also tasks like cooking, cleaning, and garden care. This is the examination on this date. This is the treatment that we have given on this date, okay. Then we have today's visit. This is today's visit. Patients was brought by daughter, severely low mood, and was having, hearing voices and seeing his mother, his wife or mother, I don't know, mother, okay. Then is the examination, and then we have no interest in life, insomnia, and no desire to eat anything, suicidal thoughts, and this is our plan, okay. This is our plan, okay. Now, so almost you have spent almost 2 to 3 minutes of your reading time. Let us say 5 minutes of reading time. Now, before you start writing, what you need to do before you start writing, we have read the case notes. So before we start writing, what we need to do?
Case note selection.
Case note selection, very good. Okay. Any other thing?
Look for relevant or irrelevant information.
Very good. Pick out relevant, irrelevant. Okay, very good. What else? After you decide what is relevant or irrelevant, what do you need to do?
Organization.
Make a plan. That we call as make a plan. Okay. Make a plan for your writing. Okay. Parastructures. What you will write in each paragraph. Okay. How you will organize. Okay. Now we know the diagnosis. We know that is referral letter. Okay. So now my question is, which type of referral letter is this is? Normal referral or urgent referral?
Urgent referral.
Urgent reference.
Why?
Urgently transferred to
Suicidal thought.
Where it is written
Depressive
urgent referral?
psychosis.
urgent transfer.
In the plan, sir.
This case is psychosis, but this is not your medical exam. Okay. In OET, they will give you something that you can just take a little bit clue. Okay. Is there
Transfer.
anything mentioned here specifically? Please mute. Only 1 or 2 people can talk with me. Other people mute, please. Okay. Let me take Miss Naseem and Miss Amina, 2 of you. Miss Naseem and Miss Amina, 2 of you only. Okay. Other people mute, please. Okay. Is there anything you can see in here in the plan or in the task which says that it is urgent referral letter?
No, sir.
No written urgent referral.
Very
but
good.
okay.
And Miss Gypsy, why is it normal referral?
It is written strict or immediately.
Just, is there any word in the plan or in the writing task which says that this is urgent
Yeah,
letter or not?
Yes, because they call for ambulance to
transfer-
psychiatric department. They will transfer the patient immediately
Ah,
because he has
very
suicidal
good.
thoughts
Very good. Miss Sonia
and
on
poor
Facebook.
appetite.
Miss Tatiana on Facebook. Very good. So they are writing immediately. So, you know, believe me, after I have sent you the case notes to all of you, then I was thinking, I have not mentioned anywhere that this is urgent letter or not. I don't know what the students will do. Will they write as urgent letter or normal letter? But now, after I started discussion, so here it is written, so it means it's urgent letter. Okay, immediately call 99, transfer immediately, it means it is urgent letter. Urgent letter does not mean you will see the word urgent in your plan or the task. Okay, please. So you also need to use your mind. Okay, use your sense. Okay. Okay, so done with this.
Yes,
Now
sir.
let us decide what
Yes,
is
sir.
relevant or irrelevant. Okay, so this is urgent referral. Okay, to whom we are writing?
Clinical
To
Clinical
whom?
psychiatrist.
Clinical psychiatrist.
Dr.
Okay, so who is clinical psychiatrist? Is me. Okay,
Dr. Che.
sometimes you will me see as a GP, sometimes you will see me as in the next case note, maybe I am something else. Okay, so don't worry about this. Okay, you will see this is constant. Okay, so now let us decide what is important or not. Okay, the case is depressive psychosis. Okay, do you think social history is important?
Yes.
Yes, sir.
Why?
Because he lives alone.
Psychiatrist, psychiatrist, and I think
Because isolation causes the depressive psychosis.
So somebody on Facebook is saying it is not important social history. So why not important, please? Why social history is not important here on Facebook? Is there anybody that who says that social history is not important? I will see in your letters because I have evidence here, please. Okay, I have 30 letters here. Okay, so just tell me the truth. Social history is important or not?
Yes, important.
Is important. The problem is depression.
yes,
And
sir.
most of the cases, social things are important. Okay. But not all the social history is important. Okay. If you write all of these things, how long your letter will be? Too long. Only with social history, you will be writing more than 80 words. Okay. So in total, we have 180 words to write, 180 to 220. Okay. So what is important here in the social history?
Marital status,
So just marital status.
job
So,
description, his employment,
okay. So what about children? We should write about
Children
children or
lives
not?
abroad. Yes, important. Children lives abroad.
We should
And
we
his
mention their
daughter will
Dubai business in London, and
No, sir.
his
No,
daughter has
maybe.
already 2 kids and visits father monthly. So
No.
what about this?
No, sir.
You
Just
can
There
married
are
just
with
some
three children.
things. Okay, some things that are important. He is married, has 3 children. Okay, okay. You can mention 2 sons live abroad, and his daughter lives in London, and her visits are very important. Her visits
Yes.
once monthly is very important. Okay, this is stressful job. Just quickly mention the stressful job. Okay, what about high hobbies?
No need.
Not
Why?
important.
Not important.
Okay, let me just take one person, Sarah. Miss Sarah or Dr. Sarah, whatever you are. Other people, please mute. Okay, becomes very difficult to manage the class like this. Okay, so Sarah, please, can you talk? No?
Yes, sir.
Okay, so just tell me, hobbies are important or not?
No, sir. Hobbies are not important.
Why? Other people, please mute. Other people, please mute. Otherwise, I will just finish the class and you will all be just sending me messages on Facebook. You will not be able to talk with me, please. Okay. Other people mute, please.
Other people,
Okay, so
please.
let me just do one thing. Nobody will be able to unmute until I ask you to mute. Okay. Let us unmute, not a problem. Okay. So let us go with Miss Sarah. This is very easy, don't worry. Okay. So Miss Sarah, please unmute. I have sent you the request. Unmute, please. Okay.
Okay, sir.
Okay, Miss Sarah, just a little bit loud, please. Okay. So hobbies are important or not?
I think not important, sir.
Yeah, no. But if we overthink that hobbies can decrease the stress and this and that, then it can be. But overall, in this case, it is not too important. Just leave it. Okay.
Yes.
What about smoking and drinking?
Yes, smoking and drinking is important.
It was important, but don't give too much details. Okay. What about this living alone, isolated, stops meeting neighbors 2 months ago? What about this part?
Living alone is important
Uh-huh.
and feels isolated. Also
Okay,
important,
so
sir.
this also, if you have a little bit space, you can mention. Otherwise, you can, okay, skip. Anyway, so living alone, isolation, these things are important. Okay, so what about family history? Family history is written only about his wife, Anna
Not
Malkova, okay.
not
So
important, sir. I
not
think.
important, okay. All is not important.
Yes, not important.
Okay. Okay, let us decide later on. Maybe dementia is important, but other things, pneumonia is not important. Breast cancer, let us see. Okay. What about personal history?
Personal history is important, sir.
Okay. Hypertension is important.
Hypertension is important.
COVID-19 is important.
Not
Why?
because it had in December.
In December. But why it is
So
not
at
important?
this time,
If it is in December,
he's
this is in 2005. This is you are telling that is important. This is not important.
because he's recovered at this time.
Okay. What you should write about COVID-19 is important or not to mention in personal history?
I
Post-COVID
think not.
psychosis. Post-COVID psychosis. Okay. This is when we overthink. Okay. COVID is in December 2021. Okay. And now we are in August, in September, 9 months. Can COVID prolong for 9 months? COVID will decide you will live for more than 2 weeks or not. Okay. So if you live more than 2 weeks, it means you don't have COVID anymore. So no, it is 9 months have passed. Okay. So that's COVID has recovered. Okay. This is
Okay,
just
sir.
this is just distraction. Okay. Here you don't need to use your medical knowledge, just to be straightforward. Okay, what is important not. Okay. So bunectomy for a painful bunion on left foot, February 2022. Okay, is it important or not? Just let me ask people in the chat. Don't say anything, please. On chat and on
Not
Facebook.
not important, sir.
Why? What is bunion?
Bunion means
Just a
a
small, let us
surgery.
consider small lesion, okay, a small boil like this, okay. So as a painful lesion like this, okay. So it appeared in February and it was operated, okay, it was removed. So what I have done is, this is, believe me, these case notes were written in less than last 24 hours, I mean within last 24 hours. Okay, so I was thinking I need to include some irrelevant information, some relevant ones, so that students can be a little bit confused here, so that they can spend a little bit time here. Okay. Now, this is the first visit of 16th of August 2021. So just tell me in the chat on Facebook or on Zoom, who have written this visit and who have not written this visit in their letters. Just quickly, please. Just say yes or no. If you have written right, yes. If you have not written right, no. Quickly, please, quickly. All of you should answer, okay? Yes, yes, no, yes means mix, okay? Yes, no. Me very generally, Miss Tatiana. Okay. 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 So now here is the point to decide for me which student is ready for the OET exam and which student is not ready. Okay. For me, okay. If you have written this visit, if you have written this visit in your letter, if you are a doctor, you will not get B grade. If you are a nurse, you will not get C plus. In my opinion, okay, this is my personal opinion, okay. I'm not OET examiner. I am not related to officially with OET by any means. Okay, I need to tell these disclaimers so that my pages are not blocked anymore. Okay, so I am just private teacher. Okay, in my opinion, if you are a doctor and you tried this visit, you will not get B grade. If you are a nurse and you write this visit, you will not get C plus. This is very easy for me to differentiate between your letters, which one is good, which was not good. Okay. If you have, some of you are writing just in one sentence, you have mentioned in one sentence, I can accept it. Okay. I will see how you have mentioned in your case, in your letter. If it is very tactfully and very, very concisely written in just one sentence, then I can accept it. Otherwise, no. Okay. Okay. So most of nurses, believe me, most of nurses will write this visit. This is my opinion. Okay. I don't know. I will see your letters. Okay. So can anybody tell me why it is not important to mention this visit? Anybody can tell me? Let me unmute. Okay. Just 1 or 2% can unmute. Okay. Yes, please. Why? Why?
Because no relation, already cured, and he takes antibiotic and he's fine.
Very good. Are you a doctor or nurse?
I'm doctor.
Okay. So what is UTI? An infection. Okay.
Yeah.
An infection. If we give patient antibiotic, it will be recovered. Okay.
Yeah, it is already resolved in the next visit. He mentioned it comes low and he's fine.
Okay.
Regarding this problem, yeah.
Doctor, is there anything I can, if I say here that this UTI caused depression in this patient, he started feeling low after UTI, okay, then you think is important to mention or not?
It might, if this is still continuous, but it's already resolved. That's why I
no, just I'm saying,
sure.
At the end here say, Just his depression started after
Sure.
he started experiencing symptoms of UTI.
Yeah, sure. It's very stressful. That will increase his
Yeah.
more. Yeah,
Uh,
maybe
yeah.
unconscious.
In that case, we will include, okay?
Yes, sure.
If I have not mentioned anything about this affecting his mood or not, then we don't need to write, okay?
Yes, doctor.
Even we have given antibiotic. Even in the next visit, I have written that symptoms of urinary tract infection improved.
I should, in this case, I have to write, huh?
No, in this case, you don't need to write because it is
No.
improved and they are not affecting this UTI is not affecting his mood anyway.
Yes, that's why my thinking. Yeah, so fine. Yes.
Okay, there is no need.
Yes.
Okay.
Yeah, I didn't write. You can see my.
Yeah, that is good, but there would be many students who will be writing. Okay.
Yes.
Okay. So there were just two or three main things. If you write a lot of social history, then you will lose marks. If you write this visit, you will lose a lot of marks. Even your English is good.
No,
Okay?
I write only related social history about his my dementia.
Just I'm telling in general, doctor.
Yeah, in general. Yeah. Yes.
Okay.
Yes.
Okay.
Thank you.
So for nurses, it can be a little bit high level, but still you can learn a lot of things. Okay. Okay. Now we have 2 visits only. How many visits we have?
2.
Just 2 visits plus social history. This is second last visit when patient came, was feeling low due to isolation, wants to visit his wife who was admitted care home 2 months ago due to dementia. This is dementia is important, deteriorating dementia. And he was finding difficult to cook, clean, and this is the examination, this is the treatment. Okay. Then this is today's visit. He is severely in low mood, and this is today's visit, and this is the plan. Okay. Now it is time for us to plan. Okay. To plan. Which type of letter this is?
Referral. Urgent
referral.
Urgent referral.
So how many things we have in this letter? Purpose?
Social history.
Social history. Then we have 16 August. Let us see, let us write UTI visit. Okay. Then we have second last visit. Then we have today's visit. Then social history, past medical history, you can write just one thing. Then we have conclusion. Okay. So one thing that you will not write is UTI visit. Okay. This is how you will organize. Okay. People on Facebook, I'm seeing your comments. Okay. Don't worry. Okay. So you can write any important thing if you want to ask or if you want to add. Okay. So now one gone. Okay. One wicket gone. So when we have how many paragraphs? How many paragraphs we have?
4, 5.
5 paragraphs. Okay, almost 5. Okay. Today's visit, we can write like this plan in the today's visit. We can write plan in the conclusion. We will decide later on. Okay. So now, which type of letter this is?
Urgent referral.
Urgent referral. So after purpose, we should write social history. Second last visit, today's visit, or conclusion. What we should write after purpose?
Today's visit.
What we should write? Second last visit. Anybody knows that we have 2 things. One we have chronological order. Chronological order. Number 2 is order of importance. So chronological order, most of the times we can write in normal referral letters. But for urgent referral letter, what we should use?
First, last visit.
Importance, I think.
Order of importance.
Order of importance. Okay. Okay, let us remove it from here and then we have here. Okay. Purpose, social history, today's visit, second round visit, conclusion. Okay, this is one thing. Other is you write social history before conclusion. Which one is better? Which one is better? Writing social history after purpose, writing social history before conclusion.
Before conclusion.
Who is this, please? Okay.
Before conclusion.
No, just let me tell you, if anybody is unmuted and there is a lot of background noise, just I'm really sorry, I will remove from the Zoom. You can join me on Facebook, please. Okay, because it is a lot of disturbance for all of you. We need to finish the class as soon as possible. We cannot be here for 5 hours. Okay, please. Okay, so where it is better?
Sir, before
conclusion.
Before conclusion.
Okay, so here just decide, more important is social history, or more important is today's visit when he is having suicidal thoughts and he is a lot of depressed. So today's visit is the most important visit. This is the after purpose. We should write the most important thing. Okay, most important visit. So what is the most important visit here? Is today's visit. This is my now organization. I will write purpose. I will write today's visit. I will write second last visit. I will write social history here. I will write the conclusion. Okay. Thank you so much for your likes on Facebook. Okay, now when I used to write my letters more than 2 years ago, I used to write this part, DrChe, clinical psychiatrist, Greenfield Hospital, this and that street and Manchester, very quickly at the start before I started planning, because then you don't need to waste time. You directly start from the purpose. Okay. So write this. And then you need to write today's date, one blank line before and after date, then dear DrChe, and then regarding patient, the age of the patient or date of birth of the patient, and then start your purpose. So all of you know about these things. Okay, just I'm telling what I used to do to save my time. Okay, very quickly at the start, I used to write these things on my answer sheet. Then I was planning and these things. Okay, so what we need to write in the purpose? 2 things. Anybody remembers the 2 things? Anybody remember the 2 things that we need to write in the purpose?
Current
Diagnosis.
situation and from the reader.
Okay, let us.
What we want from the reader.
Okay.
Yes, what we want to read from the reader.
Okay.
What's wrong with the patient and what we need from the
Very good. Very good. Okay,
Yes.
2 things. Number 1, what is wrong with the patient? Okay. Number 2, what we want from the reader. Okay.
Want from reader.
Reader. Okay, very quickly. Okay, what is wrong with this patient? What is wrong with this patient?
Depressing by
Hallucinations.
Hallucination is just one symptom. Just one symptom. Hallucination is just one symptom. What is the diagnosis?
Depressive psychosis.
Depressive psychosis.
Depressive psychosis. This is the symptom. What we want from the reader?
further
investigation and
investigation and
investigation and management.
Is it written
Assessment for
management here
depression.
anywhere?
Investigation and
Assessment is
treatment
written.
plan.
Assessment
Please,
for
please
depression.
don't use this memorized a sentence. Assessment and management would be highly appreciated. Be specific where you can. Okay. Here I have written further investigations and treatment. Just write this. Okay.
okay.
This is written here. Further investigation and treatment plan. You don't need plan. Just treatment is enough. Okay. So I will write. I am writing I am writing this letter to refer Mr. Martin. I just need to use surname Mr. Martin. Okay. Then I can write a 63-year-old man, a 63-year-old NHS manager. Okay. So you can use the profession or a gender or age or whatever. Okay. So a 63-year-old NHS manager, you can write like this. Okay.
To Ayatul Kursi. For this small one, we did not find. Okay.
Where please? Sorry, I didn't understand what you're saying. It is not wrong. It is not wrong to mention further investigation and management is okay. But just I'm telling, at least don't write further assessment and management because here it is written investigations. Treatment means management. You can use as synonym. Okay. But investigations, don't write assessment. I would prefer the investigation, the word, same word. Okay. Who has depressive? I will write here a 63-year-old NHS manager, a 63-year-old NHS manager, okay, who has depressive psychosis, who has been diagnosed with depressive psychosis, who has depressive psychosis. Okay, so then what we want from the reader?
So further investigations and treatment plan.
Your further investigations and treatment plan would be highly appreciated. Okay. Okay, now you people need to find the mistake. I have made some mistake intentionally in this purpose so that you people can pick the mistakes. Okay. One by one, please. Diagnosis. What is the problem with diagnosis? So should we write? What is the problem with diagnosis?
No need for capital. No need to write capitalize.
Why in the letter? Why they have written depressive psychosis in capital?
They're just should not keep comma confused after the name.
What?
Not keep comma after the name.
Okay, let us focus on this depressive psychosis. Here it is written capital, and you people are telling me that I should write small here. Why? Why?
Because there was written in a note form.
Yeah, this is notes form. Here I can use, whatever. I just to make it a little bit more means more important. I have written it capital. Okay, just to make it a little bit more important to see. Okay, this is just notes. Okay, but medical conditions we write in small unless it is written and the name is given after someone's name like Parkinson disease, Alzheimer's disease. Okay, so it would be in small. Okay, any other problem here in this first sentence?
Who has been?
Not confirmed, I think.
So somebody is saying on Facebook we cannot use abbreviations. Abbreviation like
been?
NHS we can use, abbreviation we can use. This is called contraction. Can we use contraction here?
No.
I am.
No.
In OET letters we cannot use contractions. Okay. Anything else in this sentence?
And no need comma after manager.
This is optional comma. You can use, you can skip. Okay. This is not a problem. If you use it, it is okay. If you skip it, then it is okay also. I would prefer to write, but without comma is also okay. Anything else?
Sir, can we write like this? Who has been suffering from Depressive psychosis.
Suffering from is not liked in your letters, in OET
Alright.
letters. Suffering from a little bit, awkward.
Alright.
It's just like outdated word like this, not good word.
Sir, we can write
Sir,
I
who-
to refer Mr. Martin.
Sir, what
What?
about who has been diagnosed with?
who has been diagnosed?
Who has been diagnosed is okay. Who has depressive psychosis, okay. Both are okay. Don't worry.
We have features of depressive psychosis.
Also, who is being managed?
Who is being managed? No, he just came today with depressive psychosis and you are sending to the other doctor. You are not managing already.
We can write like I am writing to refer. This letter is not necessary.
This letter is not important. Mostly nurses, mostly lovely nurses, they want to write, I am writing this letter. Okay.
Yes.
Who has developed is also okay. Okay. Who
Also,
has
there's
developed
no
is also
any urgent sense in your introduction.
Wow. Who is this? Who
That's
is this? Otto. Who is this?
That's me, doctor.
Yeah, are you? But how we can know who are you?
I am Dr. Hawazin.
Okay, that was very good. Very good. Okay. Is there any mention of urgency? This is immediate letter, urgent letter. Is there any mention of urgency in this letter?
No.
No, we can mention I am writing urgently to refer.
Okay, I am writing urgently to refer. Okay. So if you don't write, where else you can write?
Writing to
We can
refer
write your
I'm writing urgently refer Mr. Martin.
urgent further investigation.
Yeah, further then I will skip further, just your urgent investigations and
Okay.
treatment. Okay, plan is also not needed. Plan is also not needed. Your further investigation and treatment would be highly appreciated. Okay. Now your purpose is okay. So all of you, please correct your letters by yourself, because if you have written before class, it is very good practice to learn. If you have not written, then you will learn less. Those who have written their letters, they will learn more than those who have not written. But if I find time at the end, I will mark your letters, but let us see what happens. So we have written the purpose. Okay. No, this visit is irrelevant for us. We will not write this visit. Okay. Then we have two visits, this visit and this visit. Which one we will write first?
Today's visit.
Today's visit. Okay. Let us take some nurse's letter here. Okay. Okay, so you can see purpose and then auditory and visual hallucinations. So this is not good way. We should start with date. That is more, let's keep it. Some other nurse. This nurse who has written me in the morning. Okay, this nurse is writing initial visit first. Okay. Okay, let us take this one. Who is this? Miss Shivaji Pila, whatever it is.
Yes.
Are you there?
Mr. Yes, sir.
Mr.
Yes, sir.
Mr.
Shivaji.
Sorry, Mr. Okay, sorry, I don't know exactly, Mr. or Miss. Okay, so Mr. This is your today's visit. Okay, today
Yes,
Miss Martin brought back by his daughter. Okay, so anybody can point out any mistake in the tense here? What we should write?
Outer for the first time.
has brought, I think.
Has brought. Very good. What else?
Yes.
Anybody else?
No need to write back.
Brought by his daughter. No need back.
No need.
Back. Okay, let us copy.
That
Let us copy here because we need to write the keep the original also. Okay, you want to remove back. Okay, what else?
Brought.
Was
Is
brought.
brought by his daughter.
Very good. So on Facebook you can see was brought. Would prefer was brought. Okay,
Yes, was brought.
was brought. Okay, so because we have already discussed this in our free class. So here we need to use passive voice.
With the
Auditory and visual hallucinations, depression, insomnia, and suicidal thoughts. Very good. Okay. So what I have done intentionally, you can see, I have written here low mood in the first sentence, auditory hallucination here with hearing voices of his wife, then visual hallucination, seeing his mother cooking for him in the kitchen. Then I have written here about eating. Then I have written examination. Then I have written about interest in life, then activities, then insomnia, then suicidal thought, then about eating. So why I am doing this? Can anybody tell me what is the purpose of the examiner?
To show him the severity of the case.
To distract us.
No.
To confuse us. The important thing.
Unnecessary
He's worsening with
information
the
at the
time.
They want to check our organization level.
What is this? The last one, who was this?
Organization.
Who is
level.
this?
Mr. Shivaji, sir.
Okay, Mr. Swaj. Okay, this is what I want to see, whether you can organize or not. If you start write this, okay, I am writing, okay, today Mr. Martin was brought by his daughter. He had severely low mood. He was hearing auditory hallucination, hearing his wife's voices, and he was seeing his mother cooking for him in the kitchen. Due to visual hallucination, he was not eating for the last 5 days, 7 days. On examination, his blood pressure was 130 by 80, pulse was this, temperature was this, and current weight is this, BMI is this, and he has no interest in life, unable to perform daily activities, and sleep insomnia, and he has no desire to eat anything, and he has suicidal thoughts. What should be score for me? What should be the score for me?
C.
See, then I will, what you know what I will go? What I will do? I will go for remark. I will spend $120 on remark because you have given me C. I want C plus or B. What I'm doing? Simple sentences. Number one. No organization. I'm just taking the information, just putting in the sentence. This is wrong. Okay. What we need to do?
We need to emphasize the most
to make it concise.
So make it concise, we need to organize. Okay. What is the most important symptom in this visit?
Visual and auditory hallucinations.
Severe low mood and suicidal thought.
Hallucinations.
Suicidal thoughts and
depression.
hallucinations.
Suicidal thoughts and hallucinations.
Just let me tell you that patient will not die due to auditory hallucinations. Patient will not die due to visual hallucination. He is just seeing his mother is cooking for him. He is just hearing his lovely wife's voices. So he will enjoy it. He will not die due to this. Okay. So even these are important. Medically, these are important things. But what is more important than the auditory hallucinations and visual hallucinations? Very low mood, very low mood, and suicidal thought. These are important.
Yeah, suicidal attempt.
Imagine if one student write this visit and write the suicidal thought at the end as it is written here. Do you think he will get C plus or B?
No.
I did same.
Okay, we need to write, this is organization and according to the importance. Okay, we need to bring this suicidal thought at the start and the severe low mood. Then we will mention auditory hallucination. We will not mention he is hearing wives voices or not. We will not write his mother is cooking for him or not. Just write the medical terms: visual hallucination, auditory hallucinations. Okay. Okay. And then what else? What other symptoms we have?
It was not eating for 7 days.
Not
Weight
eating for
loss.
7 days. So what you will say? Not eating for
Insomnia.
7 days.
Anorexia.
Anorexia, or you can say loss of appetite. Both are okay. And sleep problem.
Also insomnia.
Insomnia. Okay.
Insomnia.
Okay. So the thoughts. Okay.
Insomnia.
So then it's interest in life and unable to perform daily activities. So now just keep telling me. So we have very low mood. Then we have auditory hallucinations. Then we have visual hallucinations. Then what else we have mentioned here?
Anorexia.
Anorexia, I will prefer
Anorexia.
loss of appetite. Okay, loss of appetite. Appetite. Okay, what else?
Insomnia.
Here we have no interest in
Insomnia.
life. Just no interest of life. I can just say low mood or suicidal thought. Just okay. Daily activities. Unable to perform daily activities. Okay, insomnia. What else?
Suicidal thoughts.
Suicidal thoughts.
Suicidal thoughts. Okay. But we will not write all of these things in one sentence because it would be difficult for me to understand. Okay. Today, Mr. Martin was brought by his daughter. Okay. Then with complaints of due to whatever you want. Okay. With the complaints is okay. With complaints is okay. With complaints of very. So first I will write very low mood because this is the main diagnosis. Then suicidal thoughts. Suicidal thoughts.
Visual and auditory
Okay, this unable to perform activities of daily living. I can keep it for next sentence because then it will become too long. Okay, suicidal thoughts, and then I will write comma, insomnia, and loss of appetite. Okay. Okay. So now we have, oh no, still we have auditory and visual hallucinations. Okay.
in addition to.
So I will keep loss of appetite and these things later on. So the thoughts and visual and auditory. This and is for to join these two things. This and is for these two things. Okay. And visual, or you can use only one and visual and auditory hallucinations. Okay. Now this insomnia, loss of appetite, lack of to perform daily activities, I can join in one sentence. Okay. You can use in addition or also. Also, you can use present tense or past tense, but I will use past tense. Okay. Also, he had.
He has.
I will prefer. Okay. Past. Okay. Also, he had insomnia, loss of appetite. Even you can skip one or two of these. We don't need to write each and everything. Okay. Loss of appetite and was unable to perform activities of daily living. Okay. Done? No. Okay. Now what else is important? Anything else in the today's visit?
Weight loss.
Weight loss? What you will write?
He lost almost 13 kg.
Let us see what people have written here. Okay. So here is one nurse, Miss Tatiana. Okay, let us see what they have written. Okay. Okay, they have written medications and then additionally on examination, writing examination at the end and have written, medication first and writing examination at the end. This is wrong organization. You can see here are the symptoms, then lack of sleep and other symptom, then, medication, and then writing the examination. Okay, this is not good. Okay. Examination at the end, no. Here treatment should be at the end. Okay, so here is one person who have written this, other nurse. Okay. Here is another nurse. I know doctors will write better. That is why I am taking nursing sentences.
Sometimes no.
Yeah, but not all. Most of the doctors are good, but your score is okay. So, and this is first Miss Tatiana's sentence, and this is other nurse. Sorry, Sivaji. I don't know male or female. Sorry, Mr. Sivaji. Yeah, Mr. Okay. So, Miss Tatiana, additionally on examination, we don't need additionally for examination. Okay. His vital signs were within normal range. Even we can skip if normal, wider than normal, we can skip. Okay. Apart from his BMI, which is this. Okay. Periodically, he has lost his weight due to less intake of food. We don't need. This is not. You cannot say the direct reason. This is not only lack of food, maybe depression. Okay. Depression is directly cause of weight loss. Okay. Even if you eat well. Okay. His current weight is this one. Okay. So you have seen two letters. Can you imagine the severity of weight loss with these two sentences, with these two letters? Is there any comparison? Any comparison?
Yes, it's comparison 68 and then 55 kg.
Where is comparison?
So in case notes.
But here I'm asking there, these are the real letters that were written by your colleagues. Okay.
No.
But
Nothing mentioned.
Okay. If his current weight is 55 here, his current weight is 55 here. Maybe his last weight was 56, now is 55. Is it important now to mention?
Yes, it's important.
1 kg?
No, not a big deal.
No.
1 kg is no.
No other question. If you lose 2 kg weight in 2 months, is it important?
No. It's not.
Yes.
People, you just don't need to write whatever it is written in the case note, just make a sentence of it and just write and get your score. This is not the thing, okay? Please. You need to make the life of the reader easy, okay? Or you can make the right of the reader. Here in the first visit, this visit, patient has lost 2 kg in the last 2 months. And his current weight is 68 kg, BMI is 23. Okay. Now I am writing today's visit. What is day today? 3rd of September. What is this date?
23/8/2022.
So how many days?
10 days.
10 days. You can write 10 or
10
11.
days.
Don't worry about August has 31
Within
days
2
and
weeks.
this. Okay. Just write 10 days. Okay. And almost you can write in almost 10 days. Okay. How much weight loss is there?
13 kg. 1-3.
How you know this? This is not written. Is there any written 13 anywhere?
It's
68
68
minus
and then
55.
55.
Do you think you will do the calculations there?
We can.
Yeah, the important ones. Don't
Yeah,
start
roughly we can.
calculating
Yeah.
each and everything. Okay, just some people, you know,
Yeah.
some people start writing this. Okay, so if the age is not given, so for example, if it is not given, so they start 59 and then up to 2000, we have 41 years. And now we are in 2022. So 22 plus 41. So it would 63 years. A 63-year-old male. You don't need to calculate. If age is not given, you don't need to calculate. Okay. But here it was important. Okay. So how much weight this patient has lost in just 10 days?
13 kg.
13 kg.
13 kg. Yeah.
Yes.
This is how you
Yes.
need to highlight the important things for the reader. Then you people keep saying, I keep getting C grade. I keep getting C grade. Nurses, especially, I have taken the exam for 5 times, 4 times, 3 times, and I still getting C grade. What is the reason? The reason is you are not making the life of the reader easy. Okay? No. So how much weight loss in 10 days?
13 kg.
If you write like this, his current weight is 55 and BMI is this. Which one is better? Weight loss, okay? Let's do it. Should we write BMI also or just weight loss is enough?
No.
Should we write
We can mention.
BMI? Why?
This is enough, I think so.
This is
Why?
not within normal range.
Yes, that is why not within normal range. Otherwise, I should not have mentioned it. Okay. So what I will write here in this letter at the end. Okay. Examination, other examination normal. Okay. You can write his examination was unremarkable, except he has lost this waist, but I will not write other examination. His examination is normal, unremarkable, except that he has lost. You can write like this, or you can write, okay. He has lost 13 kg. Okay, in the last 10 days, and his current weight is this one, or his current BMI this one, whatever you write. Okay, I will say his current BMI is. I will mention in the second last visit the weight 65. Then if I mention 30 kg has lost, I don't need to mention 55. Okay, it's for me. Okay, it's a little bit high level, but you don't need to worry. And its current BMI is 17.5 or 3, whatever it is written there. This is one way. He has lost almost 13 kg in the last 10 days, and his current weight is 55 kg, or his current weight and BMI is this and this respectively, whatever you write, but for me, it looks like this better. Now, is this easy to understand or not? Easy to understand or not?
Yes.
Okay. When you will write this visit, this weight loss is not too important. Okay. Just mention current weight or BMI, whatever you want to write. Okay. Okay. So now we will write the medication here in the same plan. After that, you can write the treatment. Okay. He was commenced on this or that, or he was administered 12.5 milligram risperidone and diazepam 10 milligram. Okay, so you can mention this at the end of this. Okay, what else we need to write from the plan? Okay, medication we will write. So this we will mention in the letter or not in the plan, in the conclusion, whatever, wherever.
Yes, we will write.
We should mention or not?
Yes.
Where we will write? No need there. This is for you just to do. Okay.
No, doctor.
Do you think the psychiatrist who is there in the hospital, he need to know that you have called the 99, then the ambulance came,
No.
or you have just
No.
No,
you just
absolutely
found the
not.
ambulance on the road and you gave
No.
hand and the ambulance came?
No.
This is just distractor. Okay, distractor. Okay, this is just to show you it's an emergency case, but you don't need to mention in the letter. Okay. Do you think you need to mention that I have advised to the paramedics that the patient has suicidal thoughts?
No.
No
You will
need.
mention.
No need.
No need. This is just for you to do.
No
Okay.
need.
This is just for you to do, but not to mention for the psychiatrist. Okay. Inform patient's wife about his current condition. You will
No.
inform or not?
No.
You will inform his wife.
No.
You will inform his wife. This is your
We
task.
have to inform the wife, but not for the
But you will not write in the letter.
in
But
the letter.
we will not write.
Write in the letter.
Okay, you will inform his wife, but you will not write in the letter. Okay.
Later.
Assessment, of course, you will write. Okay, this visit you will just write. He presented on this date with as he was feeling low. Okay, due to isolation, and wanted to visit his wife who was admitted 2 months ago due to deteriorating dementia, whatever you can mention. Okay, then just write he was he had difficulty to manage his household tasks like this and that. His examination is completely normal. You don't need to mention, just you can mention briefly the weight, and then just quickly write the treatment. He was commenced on diazepam and okay, exercise. Was advised to exercise regularly. Don't write on regular basis, right? Regularly. And okay, and cognitive behavior therapy, as you just can write CBT, was advised with the local counselor. Use the local counselor for 5 days, even if you want to mention 5 days or not. Okay. This visit you will not write, and here social history you will briefly write the social history. Okay, just briefly. Okay, anybody is tired? Anybody is tired?
No, sir.
Okay, if you are tired, you can leave. There is no obligation. Okay, for the club. Okay, so now just quickly go through, because I cannot give detailed feedback, but I will quickly go through your letters. Okay, quickly. Okay, it will not take too much time. So first of all is Dr. Fayaz is there on Facebook or here on Zoom, anywhere?
Yes, sir.
Okay, thank you. So doctor, here we don't need to leave blank line, okay, between dear doctor and regarding this patient. Okay,
Okay,
here we
sir.
don't need to leave blank line. Okay, so here just a little bit space that everything
Sir,
is
what
okay.
about the
I
date?
prefer
We
here
have
the month and age. I mean in words. I prefer this one. This is okay. It's right. I prefer in words. Okay.
Sir, I am
Yes,
asking
please.
that in letter, today date we have to write Is it
In the real
last visit
exam,
date?
in your practice, you should write the letter's date. Okay. For example, I've
The
written this
last
letter
visit date?
today, but yes, last visit date. But in the real exam, you will get the same date as the exam date. Okay. Today's date would be the same as exam date. I'm writing request the regard. I am writing to request with regard to. We usually with regards to. No need to write request is here without any reason. Okay. Just I'm writing to refer. Okay. Or with regards to is also okay. Must transfer into your care. Who should come immediately after name of the patient? Please be careful. Who should come immediately after name of the patient? Demonstrating clinical features of depression for further management. So we need to improve purpose or not, doctor? Dr. Fayaz, we need to improve the purpose or not? Are you there? Dr. Fayaz. We need to improve purpose, please, okay? Today, Mr. Martin was brought by his daughter complaining of, we don't need to use these inverted commas, doctor, okay?
Okay, sir.
Just use your own language. Don't use patient's own language, please. No need of inverted commas, okay? Examination revealed he was not interested in, this is not examination. Daily activities, suicidal thought, this is not examination, okay? These are just symptoms, right in the symptoms, okay? Restoration this and this were given immediately. An arrangement for ambulance was planned. Okay, this is not needed. You can see why I told you I have mentioned these things. You people, I know that some of you will include these things in your letters. That is why. But don't worry, this is your, maybe this is your first letter or the start. Okay. So on this date, initially, you can write initially at the start. Okay, would look better. On this date, Mr. was diagnosed with urinary tract infection and treated with trimethoprim. He was improved. He was improved from infection. This is wrong. He was improved is wrong. He was improved is wrong. We don't need passive voice here. Okay. However, he developed deteriorating dementia and started to. Okay, this is just you know, little bit misunderstanding. Dementia is for his wife. Okay, he was prescribed benzodiazepine and was advised to perform regular exercise, cognitive therapy. Actually, you have tried to mention a little bit UTI, then it becomes difficult to mention the second last visit clearly. I would advise to just write the second last visit would look better. Okay.
Okay, sir.
Per day and consumes daily. Okay, he has stressful job and has diagnosed with. Okay. If you want to write since 2005, then has been diagnosed. Okay.
Okay, sir.
Has been diagnosed. He was diagnosed with COVID-19. You can see people. Those who were saying that is a very easy letter. COVID-19 is not needed, Dr. Fayaz. Okay, you don't need to worry. This is not just, maybe you are new to OET. Okay, so you don't know these things, but it's good practice. We will learn. Okay. Dr.
Okay,
COVID-19 and bunectomy is not needed. Okay, just hypertension if you want to mention. Okay, isolated over the last 2 months. His wife has dementia since this. Okay, you can see both of these are simple sentences. We should avoid writing too many simple sentences. Okay. So then, based on the above, we need to comma here. Mr. needs further assessment and management. Where here you can use a little bit different language. So overall, doctor, I will keep this letter at C grade. Okay. But don't worry, we will improve with time, Dr. Fayaz. Okay.
Inshallah.
Okay. So Dr. Hina is there. Dr. Hinza, whatever. Sorry. Dr. Hinza. Dr. Hinza is there? No. Dr. Hinza on Facebook or here with us? No. Dr. Hira? Dr. Hira? Dr. Hira is there?
Yes, I am here. Dr. Hindra.
Dr. Hira, okay. This is not good. You people are professional. Your doctors and nurses. Dr. Hira, just unmute yourself. Dr. Hira. Dr. Hinza, if you are there, I will mark your letter. If you are not there, I will not mark. Please. Dr. Hinza. Okay, Dr. Hira.
Yes, sir.
Okay.
Yes, sir.
So I'm writing to refer Miss Martin. We need
Dr.
comma here.
Hinza, sir.
Dr. Hinza.
Yes, sir.
Okay. You are Dr. Hinza, yeah?
Yes, sir. Dr. Hinza.
Okay. So Dr. Hinza, this is I'm writing to transfer is okay, better to refer. Okay, Miss Martin says you on as manager. Very good. You written manager in small. Manager should be in small. Okay, so people, you have not noticed
Okay,
by
sir.
this mistake when I have written this NHS manager should be small, not capital. NHS is capital because this abbreviation. Sorry, I then
Okay,
start
sir.
again with Dr. Hinza. Okay. So associate ordinary manager
Ji,
whose
sir.
signs and symptoms are suggestive of it is clear diagnosis. There are no question marks. I would prefer are consistent with would better. Okay. Associate management would be highly appreciated.
Okay, sir.
Try the exact word would look better on this state. Miss Martin presented to us with complaints of today was brought to the clinic with the complaint of severely low mood, suicidal thoughts, insomnia, as well as loss of appetite, and in addition, visual as well as auditory hallucinations were reported. Okay. All examination was normal. This is not good. Make a little bit more formal. His examination was unremarkable, except 2 kg
Okay,
weight
sir.
loss. You people can see 2 kg weight loss. This is in today's
Yes,
visit.
sir.
Dr. Hinza.
Ji, sir.
How
Yes,
much
sir.
is the weight loss? 13 kg.
13 kg.
Okay, I don't know is your letter or I have written Hinza. I don't know is Hira or Hinza because
Hinza.
we
Hinza.
is okay. Is Hinza okay? Okay, okay,
Hinza.
okay, no problem. Okay, so consequently, this respiratory along with diazepam were administered. Okay, almost okay, just improve. Is married, so you are not written second last. Okay, second last visit is here. So we should write today's visit first, then second last visit, please. Okay, please complain of this.
Okay, sir.
President was with complete low mood. His examination was unremarkable. Examination was unremarkable. Whether the was commenced. Additionally, please don't write 2 short sentences. You can see as a result. This is 2 short sentences. Okay, so is married,
Okay, sir.
isolated. Okay, so significant. We can write just 1 paragraph for social history. Don't write too short conclusion. Improve your conclusion. Okay. So
Okay,
Dr.
sir.
Hinza,
Okay,
because
sir.
you are not written in order of importance and some mistakes here, so it would be C plus. Otherwise, you are close to C grade. Okay. Dr. Hira is there?
Okay, sir.
Yes, I'm
Dr.
here.
Hira. Okay. So Dr. Hira, very quickly. So I'm writing to for this. We need comma here. Is this important to mention 3 children in the purpose?
No.
Dr. Hira?
No, no, sir.
No. Whose clinical features are consistent with depressive psychosis for urgent psychological assessment and management as deemed appropriate. That is okay. Today, Mr. Martin came along with his daughter. Actually, what better was brought by his daughter, but came is also okay with complaints of low mood and visual and auditory hallucinations. You have not mentioned suicidal thought at the start. Okay. So many lack of appetite and lack of interest in daily activities were also noted. Yeah, just you are writing one by one what is written in your case notes. Please organize. You know, here experiencing suicidal thoughts as well. You can see, you can join these things together to write 2 sentences.
Okay.
He was vitally stable. We don't need to write vitally stable and these things. Okay. However, he has lost 15 kg, is actually 13, placed in the just 20 days. Is it not 20 days? It's just, it ran 11 days. This is wrong information. He was administered, risperidone, this and this. Okay. On previous visits, how much visits? Previous visits?
One.
Just write that visit only, please. Don't write a lot of visits. Okay. Patient experience isolation, low mood. Okay. So diazepam and these things. Okay. Just can be improved a little bit more. Managed, stressful job, drinker. Okay, so in view of the above management, okay. Please don't write this separately. This should be just part of above sentence. In view of the above, I would be grateful if you could do this and that. Don't believe these things, okay?
Okay.
You need to improve your conclusion, please. And Mr. Sivaji is there?
Yes, sir, I'm here.
Okay, thank you for accepting Mr. Martin, who has features of different cycles. Your expertise is highly. Please just use simple language, please. Okay, you don't need A grade. You just need C plus. Okay, most of the nurses. Just use simple language as I am using. You can see here. I am writing to refer Mr. Martin and this and that. Okay, simple language, please. Your expertise is would be highly appreciated. Okay. Oh, please mute. Would be highly appreciated. Okay, so please improve. Okay, improve your purpose. It's a presented over clinic initial note. We shall write today's visit for clinic with urinary tract infection. So which was treated successfully. Okay, if you mention like this, he presented with UTI which was treated successfully. I will not cut down your marks, but okay. But he still feels isolated and unable. But he still feels isolated. Means it is today's visit. Okay. Mr. Silvaji?
Yes, sir. Yes, sir.
This is not today's visit. You are writing second last visit. Okay, this is wrong. We can't use present tense in past visit. This is my slogan 1 year ago when I was teaching nurses. Okay, unable to manage his householding tasks since his wife was transferred. We need passive voice here. Okay. Today brought by a daughter, complaining auditory visual hallucination, depression, insomnia, sort of thought. Periodically, he has lost. Okay, this I have already mentioned about weight. Examination is written at the end. It should be a little bit earlier. Pretending the above. Please don't use difficult language. Yeah, please. Okay, use simple language. Okay, just right here. He was commenced on this and that. Now is transfer to was okay. No need of ambulance and these things. Works as a manager and children and work. Okay, so rest of things you can manage. Okay. If you just improve a little bit more, you can easily get C plus. Okay. Dr. Satish is there. Dr. Satish.
Yes, yes, sir.
You already got 370, yeah? Okay. So now here I'm writing to update you on the update doctor. This is not discharge letter. Please. This is a referral letter. So feature a suggestive of suggestive. It is not suggestive. It is not written any question mark there. Depressive psychosis. You can see people how I can trick the students. Even he is my lovely student. He has written a lot of letters for me to mark, and he is one of my lovely students. Please, no capital, doctor. I'm just writing capital to trick you in the case notes. This is not a follow-up care, please. This is not discharge. Assessment would be held initially on this state. We need to write today's visit. This is discharge, not discharge letter. This is a referral letter, please. Okay. Okay. If a UTI is written there, what should be the score, doctor, for you? If there is one complete paragraph for UTI, what should be the score? Write in the Facebook, write in the chat. What should be the score? Without reading next letter, next sentences. A C plus. Okay, for doctor C plus, for nurses C. Okay. 1 week later, so the unit symptoms has been improved. So has been improved is wrong because it was in the past. Were improved. Okay. Who was been remitted. Okay. This is wrong here. Dimension. Okay, so this is a very long sentence, doctor. If you can see, this is a very long sentence.
Yes.
Okay. Which are remarkable, and he weighed this. He was commenced on this and that. Okay. Today I was brought to clinic by daughter with severe low mood associated with irritable hallucination, examination, but he in 10 days, okay, he has disturbed sleep, okay, he is unable to perform daily activities, this and that. So Salathar should be there at the start, okay. Was given stat doses of this and that. Okay, so these paramedics and these things are not needed. Paramedics and these things. Just you can mention, just write one paragraph of social history would look better, okay. So doctor, to be honest with you, this letter is C++, okay.
Okay.
Don't worry, but
Yeah.
this one is. Dr. Nadeem is there?
Yes, sir.
People, if you can see, you people are leaving the class, almost 20 of you have left the class. Maybe you have to do some important thing, but if you don't need to do any important thing, please, this feedback is very important. Explaining things just verbally is other thing, but showing you the mistakes is other thing. Please be careful, okay? Don't leave. If you have free time, don't leave. If you have to do any important thing, then it is not a problem, okay? So, doctor, first I will count your words. This last sentence is not counted. 231, you need to be a little bit concise. Urgently refer this, okay, consistent with this, your management. In this case is not needed, okay, please. Again, social history, then second last visit, then today's visit. What should be a score for you? Dr. Nadeem? C+, C+, because your English is good, but your organization is not. Is a married male with two sons who lives, okay? Two sons who lives. So what is wrong here? Nurses? Nurses, what is wrong here?
Leave.
Lives.
Wrong.
Lives should not be. Who
Live.
lives?
Sir, it should be without S. I think.
Without S, yes.
Without S.
Just give me 1 minute, please. Okay, so here, you know, who is referring back to sons, not to Mr. Martin. This is wrong. Who live, okay? Who live abroad, and one daughter who lives. This is okay. This live is for daughter, okay? Wife was transferred to home, and okay. So on this date, a follow-up state was resolved. Unit symptoms that were resolved, that he was feeling isolated, and just you can skip unit symptoms, doctor, okay? Problem, no, this is not good word. Problem, this is, you know, less formal word. Difficulty, right here, difficulty, okay? Commenced on these things. Okay, you should have mentioned the weight here for reference. Then in today's visit, you can mention the weight loss, okay? Slow mood, considerable amount of weight. So how much is considerable amount of weight, doctor? 100 kg?
13 kg.
No, sir. 13 kg.
Just I am taunting, yes. You should mention exactly,
Yes,
okay? Therefore, you can see you have mentioned, okay, this is okay, examination. No, hallucination, auditory, these are not on examination, please. Okay. Can you see hallucination on examination?
No, sir. These are the symptoms.
Yeah, we should not write in examination. In light of the has severely deteriorated. Has severely no. Just write here what we want. Okay. I would be grateful if you could further investigate her condition and manage as you think appropriate. Something like that, Dr. Nadeem. Okay.
Yes, sir.
Okay, so just let me mark this letter. Okay. So Miss Tatiana, I'm ready to introduce. Okay, introduce for every letter is not good, Miss Tatiana, please. Okay. Usana symptom suggestive. It is not written. It is suggestive or not. Better write consistent with. Okay. He is being referred to you for further investigation and treatment plan. That is okay. Having experienced visual hallucination along with Sorasa, Mr. Martin was brought by the to the clinic with 3rd March. Okay. Can anybody tell me if you have taken the IELTS exam? Anybody has taken IELTS exam?
Yes, I have taken.
This is style of IELTS, not of OET.
Yes, I am
In
taking
OET,
11 times.
yeah. In OET, what we should write? Today, Mr. Martin presented with visual hallucination with social thoughts like this. This is OET. And IELTS is okay, having experience, having, gerund, ing form at the start, using gerund will increase our marks in IELTS. But in OET, no. In OET is simple and easy to understand, okay? Okay. And in addition to this, not enough in addition to this, okay? I have already mentioned you in your previous letter, don't write to this. Just in addition, please, okay? He also has lack of sleep. He also has lack of sleep. So has is not good for lack of sleep. He has insomnia and has no interest in life. Just, organized. Consequently, he was administered. Okay. First, he was administered these things. Then we are writing. No need to write to diminish what or not. Okay. You don't need to write this medication for what. This medication for what. Just write he was given this and that. Okay. Please don't need to write this medication for psychotic signs. This was for depression. No need to write. And this I have already mentioned you about the weight. It is not clear. Recently, okay, on 16 month, okay. Now you should have written here the second last visit, not the initial visit. Okay, this was not too important. On his next checkup, despite his unit symptoms were improved, he was feeling with ing. Okay, his wife being admitted to care home. Care home should be small, not capital, as he has deteriorating dementia. As she has, okay. So social history is not written anywhere. Is it important to write social history in this letter? This is a social case. Social history is not written everything. Instead of writing this UTI, we should have written social history and we of the above. It would appreciate if you could further investigate. I would prefer if you could further investigate and treat Mr. Martin's condition as you think appropriate. So you need to improve the conclusion also. Okay, Miss Chandi is there. We have done a lot of discussion. If any of you wants to leave, that is not a problem. You can leave. If you want to continue, that is not a problem.
Sir, I
Okay.
am on duty.
Miss Chandri is there.
Yeah, sir, I am on duty.
You can, at least you can hear me. Yeah.
Yeah.
Okay. Just hear me. Okay.
Okay.
You don't need to speak. Okay. Please, for the next time, don't send me in PDF. Just send me in Word file so that I can highlight.
Okay.
Taking too much time to open also. Okay. So as it is handwritten, I will just quickly go through. We don't need to leave blank and we need DrChe and regarding this patient, and your date is not written. Please write date here after the address. I'm writing to refer Joshua Martin, who we need comma here, who was admitted is spelling mistake, MMITTED clinic with he was not admitted to this clinic, he just presented. Okay, this is wrong. Hallucination, unable to perform daily activities. We don't need to write, you can see there daily activities, insomnia, suicidal thoughts. In the purpose is not needed. We need to write in the purpose two things. Was it wrong with the patient? What we want from the patient for this patient, from the reader for this patient. Just two things, please. Okay, so your purpose is not good. Okay, he was, no, he is still retired manager. Okay, he is not, I think not retired, he is still working. It is written there that he works. Okay, where he works mean he's still working. Okay, not retired. First I have written this as retired, then I changed it. Okay, but he's not retired. Okay, this is wrong. Okay, daughter and all of these, daughter married. Okay, so you need to improve your grammar also. He has a history of you. COVID-19 is not needed, monectomy is not needed. Urinary tract infection, even it is not important, you can skip it. Trimethoprim is not needed. He is interested in gold play. This hiking and golf playing are not needed. Smoking, you can write briefly, but you have not written the main thing at the start. Okay. You are then writing about his wife, and then wonderful. You have not written even today's visit and the second last visit. You are just writing social history. You are just writing UTI. Okay.
Okay.
So you don't need to worry. Maybe this is your start, or you are taking, for the first time this exam. So you don't need to worry, but this letter needs a lot of improvement. Okay.
Okay.
You have seen a lot of discussion, a lot of other letters. Okay.
Okay, sir.
So you can see how to write a better way. Okay, Dr. Khaja Kamaluddin is there?
Yes, sir. Yes, sir.
Okay. This is how I need to, mark letters in my paid classes, but into a little bit more detail, because here we have 30 letters. In my class, I have just 4, 5, 6 letters. So doctor, I prefer to, this is not wrong, but I prefer to write date here, okay, before doctor, okay. So your word count to 33, please decrease it, okay. So who has been diagnosed? You can see depressive. Please write 2 sentences. I would prefer to write 2 sentences. Instead of needs, polite language would require, okay? Would require. Guys on Facebook, can you hear me? Just write something in the chat, because I cannot see any comments for the last long time. Please write something there. Okay, presented on this date with fever, dysuria, nocturia. Okay, so you have written the medical terms very good, but overall we don't need to write this. What should
Yes,
be the
sir.
score, doctor?
I could not get the trap of urgent letter, sir.
This was the
Otherwise, I would have
trap.
organized. Yes, sir.
This was the trap. Now, what should be the score? Even your English is perfect. What should be the score?
C.
C or C plus. Okay. Even if your language is good, then it would be C plus. Otherwise, C. Okay. On subsequent visit on this state, he was doing well for UTI. Is not good language. His symptoms of UTI were improved. Okay, but feeling low as he was living alone. Okay, so deteriorating. Okay. Don't use long sentences. This is one sentence. You can see, please. Very long sentence. Divide. Okay. He has started.
Okay, sir.
Can we use has started in the past visit?
No, sir.
He was started on. Okay. Benzodiazepines should be small. Be capital, no small. Okay. Just say the patient, no. We use name of the patient. Okay. Was brought. Mr. Martin was brought by his daughter with complaints. Okay. Okay, please don't write whatever it is written there. Just use medical terms. Okay, please. You are writing to a psychiatrist. Okay,
Okay, sir.
not OET teacher. You are no here. I am as a psychiatrist in this letter. Okay, not a OET teacher. You need to use medical terms for me. Okay, otherwise I will see that this guy, this doctor is not understanding that I am a specialist. Okay. On examination, we need comma here, doctor. Just okay. Let us see what you are written for weight. Okay. He loses, no, doctor. He has lost. Okay. He has lost around since his last visit. COVID-19, bunectomy, please. I know. You people will write it. Okay. That is why I have written these things. Okay. So, doctor, please improve. Your English is not bad, doctor. Just I think you are new to OET. Just
Yes,
you
sir.
need to work a little bit. Okay. So, order of importance and these things. Okay. So,
Okay, thank you,
Raila
sir.
Ayub is there. Raila Ayub. Raila Ayub, nurse, male nurse. You can unmute. Okay. Miss Savita is there. Nurse. Miss Savita.
Yes, sir.
Okay. Date here, please. I have already mentioned. Okay. This letter is being written to introduce. Please just use simple language. If you don't know how to write these things, if you go to YouTube, I have one channel in which just search DrChe OET in YouTube, and there would be one letter how to write purpose. Okay. So you will see there how to write each type of purpose. Okay.
Okay.
So please watch it. Okay. First write the problem of the patient, then write what we want from the reader, please. Present to hospital with complaints of auditory visual hallucination along with social thoughts and loss of appetite. In addition, he has difficulties to perform daily activities and sleep. Okay, bad, good. As being a nurse is good. His body mass index noted to as no. You have to write the main thing is weight loss. So you could not pick the main point. Okay. He was commenced on this and that. That is okay. Better to write risperidone and diazepam in small because these are generic names. Not big mistake, but we should initially we did comma here. On subsequent is okay. Just you can write one sentence, that is not a problem. On subsequent visit, that write one was this visit. When was this visit? He claimed that he feels alone at home as his wife was admitted with dementia at home care home. Therefore, he was prescribed this. He was prescribed. Okay, just improve a little bit. You are trying well. Lives alone, married. He has habit of smoking. No, habit is a single B. I think so. So habit is not good. He smokes 20 cigarettes per day. Just try this. Okay. Okay. So please don't write such a long. Just make it. This is not needed.
Okay.
Just write a short and to the point conclusion. Rehana Firdaus, nurse, please. Rehana Firdaus, nurse. Are you there? No. Rehana Firdaus, nurse. No. Anna, peace.
Yes,
Miss.
sir.
Okay. Are you doctor or nurse? Sorry to ask.
The nurse.
A nurse. Okay. Your letter would be good because I had to refer Mr. Martin with symptoms suggestive of better who has symptoms suggestive instead of with symptoms. To you for further investigation and treatment plan. It is almost okay. Just please follow our classical style. Okay. Then order of importance, the same mistake that we are mentioning in each letter. Okay. Has deteriorated dementia, hypertension, pneumonia. Okay. These things are not needed in wife. Please. Currently at a care home. Okay. Smokes. Okay. Consume this. Okay. COVID, no, please. Bunectomy, no, please. Initial user reported to our clinic on this date with complaint fever, burning sensation. Okay. This is not needed. Daughter complaints auditory hallucination, severely low mood, visual hallucination, loss of appetite for 7 days, insomnia, so that's all. Lot of things, please. Lot of things in one sentence, please. Divide, okay, as I already mentioned, okay. Difficult to cope with absence of wife at home. Okay, not any good sentence, this one. He was commenced on this and that. Please need a lot of improvement, okay. Need a lot of improvement. Your English is not a problem, okay.
Yes, sir.
Your English is good, but you know, overall letter is not good, okay. Especially organization, relevant, irrelevant information, these things. Your English is good, okay. Miss Naseem Akhtar is there. Miss Naseem.
Yes, sir.
Okay. Your letter will be good. I think so.
No, I made it
Oh,
wrong.
VIP. You are VIP hybrid course student, you know.
I mentioned UTI.
UTI. Wait, this is the same Naseem Akhtar who have taken my VIP hybrid course?
Yes, sir.
Okay, okay. But today your voice is a little bit, I don't know. Okay, I'm
Same,
writing to
sir,
urgently.
same.
Okay, urgently should be small, okay? Who has depressed psychosis, your further assessment. You people can see this is my style or not. You can see I have written in the same way. People.
Yes.
Okay, so this is what my students learn from me, okay? Was brought, T is missing, just typing mistake, to the clinic by his daughter with the complaints of insomnia, poor appetite, social thought, auditory hallucination, examination is were unremarkable, and weight was this, okay? With BMI of this, as he lost, okay, within 2 weeks, very good. We have mentioned in injection this and that were given on this date. Miss Martin visited to the clinic with UTI, therefore he was commenced on this and that after 1 week. Okay, just you can mention in one sentence, okay, improved, and BMI was this, prescribed diazepam on this, CBT, okay, socially, okay, so smokes this. How much time you have given to write this letter?
50 minutes.
50 minutes. Please write in 45 minutes, 220 words. I will give you B grade, okay, but in the real exam, yeah, in the real exam, nurses get C plus maximum, you know this, my dialogue.
Yes.
Okay.
Yes,
Just you can mention your experience with my teaching just quickly, please, because we need to mark next letter.
It was really amazing, sir. I wish I can
So,
join again, but nowadays you are not giving paid courses.
no, if you have already taken VIP hybrid, you can again send me letters before your exam. Okay, you don't need to pay extra. So, what
Okay,
was your
sir.
score before you joined VIP hybrid course?
I did not appear for the exam. Actually, I was on 0 level. Now I think I can write at least C or C plus. I think so.
But you have not taken OET exam.
Not yet, sir.
Okay, so there is other Miss Naseem Akhtar. Okay. If I am not wrong, so that one has joined
But
my
I
course.
took your classes in
When?
March. I took your classes in March, month of before Ramadan. I took.
VIP
Then I
hybrid
was
course.
on. Yes, sir. Yes, I'm the one.
But you have not taken the exam still.
Not yet. Not yet.
Okay, okay, okay. Just, you know, I can see there. Maybe I've written wrong name. So you have joined VIP hybrid course, you have taken classes, but still you are not taken the exam. Okay. So, but please
sir.
carry on. Before your exam, send me more letters. You don't need to pay extra.
Yeah.
Okay.
Okay.
So,
Thank you,
so
sir.
that we
So
can
nice
improve.
of you.
So, Sana Fauda, doctor,
Yes.
please. Are you there?
Yes, it's me.
Thank you. So let us make it black.
Sorry, by mistake, I calculated the weight from his age. Sorry.
Okay, okay, don't worry. Okay, we will make these mistakes. It's common. Okay. So I'm writing to request you an urgent treatment plan for this who has depressed psychosis. Okay, so please write classical style, doctor. Okay, classical style. Today's visit a bit long, but anyway, was brought to clinic with thought, depression, resolution. He became unable to deal with. He was unable to would look better and expressed. Okay, so apart from weight loss of 80 kg or the, this is not 80 kg, 8
That's why I
kg
told you I
is 30.
calculated it.
But at least
By
you have tried very well because it's just 13, but you have tried to give the
by
overview.
mistake.
Okay. No, don't worry,
Sorry.
don't worry. I saw is not good language. Just right on this date, he presented with this. Okay. And its manager lives. Okay. We're mentioning. Okay. Overall, doctor, I think you are new to OET. Have you taken already?
No, this is still not yet.
History, COVID, no, COVID is not needed. Okay.
You see, doctor, just I have Googled it. It can occur. Can occur even months after COVID.
Doctor, you don't need to overthink. This is OET, not, MRCP exam or PLAB exam and these things. Okay.
Oh, sorry. Okay.
Don't
Because I was
overthink. No,
right.
don't worry. That can be reason, but here you need to be straightforward. Okay. This is not your medical knowledge. Okay. We don't need to write COVID. Okay. Miss Doctor, I think you have not taken the exam so far. Yeah.
No, it will be near.
When?
Either September or October.
Okay, good. You are close to your good score, but still you need improvement. Okay, this one is C plus, yours, but your English is good. You can get B grade with little bit more. Okay, so is there next one, Miss Sabir? Miss Sabir? Miss Sabir is there? No, I think no. Okay, so Obakus, I don't know, is doctor or nurse? Is there? Who is there? Obaku. I'm sorry for mispronunciation. Is a doctor or nurse? No? Not there? Okay. Faiza Faraji, I don't know, is doctor or nurse? Is there? Faiza Faraji? No? Not there? Okay. So Dr. Kenancy is there, I think so.
Yes, sir. I'm here. Can you hear me, sir?
Yeah, I can. Thank you.
Okay, sir.
Okay, so first we will count your words. Is okay, 204. As an NHS manager, okay, a known patient with hypertension. No need to write known patient with hypertension. Hypertension is not the problem in this visit, in this, okay.
Okay, sir.
Okay, so whose clinical feature is suggestive of depressed psychosis? Your further evaluation management would be highly appreciated. Very good. Please, after this, the most important visit. Even you have not written separate today's visit in a separate paragraph. This is not good. Okay.
Okay, sir.
Dementia. Okay, his children live in this. Okay, your English is good. Okay, was found
okay,
to
sir.
have difficulties in managing household activities, low feeling due to this and that. Started on the today, he was brought to the clinics, will removed this and that. He just has, okay, this and that. I prescribed, no, I have prescribed, he was prescribed would look better.
Okay, sir.
Okay, so this is urgent letter as I have already discussed a lot of things. Okay, these are your problems, paragraphing. Okay.
Yeah.
So you cannot write all the things in one paragraph. Purpose, today's visit, second last visit, social history, and then the conclusion. Conclusion, you need to improve a little bit more. Okay.
Right, sir.
Otherwise, your English is good. Okay.
Sir, what would be my grade, sir?
For this letter, I will give you C plus for this letter,
sir.
but you can easily get a B grade if you write in the paragraphing is good, organization is good. Okay.
And organization, no, sir. Right.
Yeah.
Thank you very much, sir.
So Rael Ayub was on Facebook with us. So let us mark his letter quickly. So same problem, initial visit, then today's visit, no social history, Rael Ayub, who has been diagnosed depressive psychosis capital. He requires just have professional skills and these things. You people need to keep things simple, okay? Just write, he would require your this and this, okay? Where unit tract infection, where responded to okay, and second visa, even we don't need to mention this, okay? Found, if you mention briefly, I will accept it, okay? Low isolated difficulties to cope with household chores or manage with cognitive behavior, okay? So very simple sentence, please write two or three things together. Today, reduced weight, okay? This is not good. You need to write how much weight he has lost, okay? Ambulance and these things are not needed. We're writing to a psychiatrist, okay? Okay, so Mr. Rael Ayub, I'm really sorry, but the letter is C grade, but you can improve. You can improve with. Okay, Dr. Rabia OET. Dr. Rabia OET. Dr. Rabia. No. Dr. Sharif OET writing.
Yes.
So people, when you send me letters next time, please in the title of the file, write your names, okay? Okay, I like this. You don't need to write the number 1, 2, 3, 4 by because this is when you send me letters. First you send the upper, you will go in the list, okay? But you write your names like this, okay?
Yes.
You know, each of you is getting 5 pounds of gift because one letter marking is worth 5 pounds plus
Yes, sir.
1.5 hour of class.
Yes.
That was, you know, just mind blowing for me, explaining a lot of things.
We are lucky.
That is why we will not take class on daily basis because it's very difficult for me to manage the things. I'm too busy at work and, you know. Okay, doctor. So if we read the purpose, what do you see, people? All of you?
Very lengthy.
Okay. So if you don't get 2 out of 3, if you don't get 2 out of 3, so can we get B grade even your rest of the letter is
No.
excellent? Never. Okay,
No.
never. So purpose just we not 2 things, Dr. Sharif. Can you hear me?
Yes, yeah, I'm just new on OIT. This
Okay,
is my first
no
time
problem,
writing.
doctor. Not at all. Not at all. Okay, you will learn. Okay, you can go to YouTube. You can watch my videos how to write purpose. There is one complete video, a 1.5 hour video. Okay, so a very, you know, I have explained all the things how to write purpose, especially as on
Other
purpose.
than purpose and what about the language and the rest of the?
Yeah, just everything I will tell you. Okay, and purpose we write two things. What is wrong with patient? What do we want? Just 2 things. Okay.
Yeah.
This social manager who presented today with complaining of retributive solution and allows just write the main diagnosis. Okay. I found. Don't write found. Just write what you found. Okay. Don't write I found. Okay. His weight was this. Okay. So just write the comparison. I am explaining. Okay.
Yeah.
Somebody has the thoughts. He has simple with the process. Okay. This should be at the start. Okay. He received. Okay. So just he was given instead of received. He was given. Okay. He was administered. Yes, Miss Martin, he is okay. So exercise regularly. He is living alone. He lives alone would look better. Okay.
He's living
He
alone.
is isolated. He is not wrong, but it's not good. For a habit, for a routine, we use present simple. He lives. Okay.
He lives. Yeah.
Okay, because of dementia, he has a difficulty in cooking. Okay. We don't need where they live, Dubai and these things. Just make it a little bit simple. Okay. Golf and these things are not needed. Just
I'm
as
just
you are
trying
new.
to tell. I'm just trying to tell him it's liver far away from him. It's not close to him. Maybe this all.
Yeah, but when you will be used to OET letters, you will see how to make the things concise. Okay.
Yeah.
Language wise, doctor, I cannot find any big problems, but overall, you
how many words in it?
This letter.
Yeah.
Yeah, we don't.
182.
we count these words. 232 almost. Okay, so just you can skip the irrelevant information. And after purpose, we were at today's letter, today's visit, then previous visit, second last visit, then social history, and then purpose, then conclusion, doctor. Okay.
What's about my score? This one.
Score would be low, see, but you can easily improve if you work on. Yeah, just you can see how this is the student. The purpose, here is the purpose, then is today's visit. Okay, like this. So is there this student, Miss Priya? Miss Priyas.
Yes, sir.
Is there? Okay.
Yes.
Okay, so here is your greeting. I'm writing to refer Joshua Martin, who has been treated for depressive psychosis. He is being urgently transferred today and would require use polite language. Okay.
Okay, sir.
With complaints of this and that. Eating is not too important to mention in first sentence. Unable to perform direct activities. Suicidal thoughts. Suicidal thoughts should be at the start. This is what I have already told you. Okay.
Okay, sir.
Then we should write to second last visit. Then this visit. Okay.
Okay, sir.
Stops. No, stopped. It was in the past. Stopped. Okay.
Stop the meeting.
If the time is not given. If the time is not given, then just he smokes 20 cigarettes per day. If time is given for the last 10 years, then it is okay. He has been smoking 20 cigarettes per day for the last 10 years. If it is without for, then he smokes 20 cigarettes per day is enough. Okay.
Okay.
Okay. So, okay, just UTI, these things are not needed. If you could perform. Okay, so you have tried well, but still this letter is C grade. 228, you can be a little bit more concise, improve paragraphing, okay? And need to improve a little bit grammar also. Miss Charita is there? Miss Charita is there?
Hello, sir. Can you hear me?
Yeah. Okay. Other people, please mute. Okay, just let her talk. So what is the purpose here? How many lines? Please, purpose just 2 things, okay? I'm writing in this letter. Again, you can see this letter. What I have written when I started writing letter. Regarding further investigation, urgent treatment of his depressive psychosis. He often feels isolated, so it should be right social history separately. Okay. Alone for past 2 months. Okay, care home for okay. He started meeting neighbors 2 months ago. Okay, he reported difficulty in managing household. Diazepine was given. Okay, and he was arranged. CBT was arranged. Okay, you can mute, please. If you need to talk, you can talk. So was brought to our clinic with his Miss Somia, you need to mute also. Miss Somia, please. Today, Mr. Martin were brought to clinic by the doctor with once monthly complaining of worsening sign of symptoms. Okay, you can see a lot of symptoms here in one sentence. This is not good. Okay, it would be difficult for the so reader to understand. Dr. Rabia is there. Okay, Dr. Rabia. Okay. He also reported of no interest in food activities. Okay, examination and immediate decision. Okay, this is not needed. Immediate decision was made, and these things are not needed.
Okay, sir.
Paramedics, these things are not needed. Okay. Increase after by hospitalization. Okay, for further investigation. Okay. So overall, we need a lot of improvement. Okay. Are you taking OET first time?
Yes, sir.
You need to improve a lot. Okay.
Okay.
So please, I would keep this letter at C grade. Okay.
Okay, sir. Thank you, sir.
But don't worry, you will improve with time, okay?
Okay.
Dr. Rabia OET, this is your name, Dr. Rabia OET. How you have sent me? Dr. Rabia? Dr. Rabia? On Facebook, yeah, okay. Okay, your word count 215. I'm writing to transfer, better prefer, I prefer refer, okay? Here we need hyphens, please hyphens. Whose presenting features are suggestive of different psychosis that needs to be help, that needs the help for, please just use more typical language. Then full stop after depressive psychosis. Your proper is also not good word. Your further investigations and treatment or management would be highly appreciated like this. Okay, use typical thing. Okay, by his daughter as she was experiencing. Okay, yes, you should write today. Okay, today at the start so that everybody knows that this is today's letter. Okay. He also complained of atrial hallucination with no interest in life and had insomnia and anorexia. On examination, we need comma here. He had lost significant weight from 8 to this. This is also good way, not good way, but at least is evident that he has lost weight. But you people can see what is not mentioned here in how much time. Weight loss is mentioned, but is not mentioned in how much time. Is it equal to lose 13 kg in 1 year and 13 kg in 10 days? Is it equal? What do you think?
No.
No,
We
okay.
need to mention the time period.
Very important, very good, okay. Different psychosis was assessed for which urgent intramuscular shots of, this is not needed, shots of and these things. Just he was given risperidone and diazepam, okay. No need to write shots and these things. I think you are also new to OET. Think so, it looks like, okay. Determination was call was given, department call was given. This is not your ward doctor, this is formal letter. This is language that we use in our ward when we are working in the ward for patients, writing calls to other doctors. This is not language here. Here we need formal language, okay? This is not needed. This sentence is not needed. Okay, Mr. came to clinic regarding the mental state. He complained of isolation. Okay, so okay, there's the these things. Okay, so you need a little bit of write more about social history. Okay, let us do this. Okay, so Dr. Rabia, this letter I will keep at C+. But overall, your English is good. You just need to know what we need to write in OET, what we should not write, how to improve. Just improve a little bit more to get B grade, okay? But this is C+, okay? You can improve a little bit more. So we have done, Miss Priya's done, Miss Sharita done, Miss Merlin.
Yes, doctor. Good evening.
Is my Miss Merlin VIP hybrid course? Yeah?
Yes.
Are you the same Miss Merlin or any other Miss Merlin?
Yes, I'm here, doctor. Speaking, please.
Okay, just I'm asking. You are the same Miss Merlin? No, that is Miss Annalene. Sorry.
Ah, okay.
Are you taking any course with me?
Yes, doctor.
Which course?
For OET.
Which writing, speaking, which one?
Writing, doctor. Writing.
But there I have written Annalene and here it is Merlin.
Yes, Marlene.
Oh,
Yes,
I
that's
have
my
saved.
letter, doctor.
I have saved here you as Annalene. I don't know. How many letters you have sent me so far?
Only one, doctor. I think that one is my writing letter.
Okay, let us leave it. Okay, so let us see your letter. So WhatsApp number is not important to write here. Just this was just to advertise my WhatsApp number. Okay, so but you don't need to write in the letter. Okay, so this one it is not wrong here, but I would prefer to write here. Okay, after the date.
Ah, okay, doctor.
And here we don't need blank line. Okay, so I'm writing to refer Mr. Martin. Okay, who requires further investigation treatment plan for signs and symptoms of depressed psychosis. This is good, but if you divide it to 2 sentences, would look better and easy to understand. Okay.
Okay, doctor.
Dr. Rabia, your letter is good. You just need to practice and get feedback, and get some help from any other your friend who have taken the exam, or just watch some videos. Dr. Rabia, your English is not bad. You just need to follow OET style. Okay, your style is just like informal as we use in the words. That is, today we started was broad. Okay, was broad. So we need passive voice here. So do severely low mood. She was experiencing voices of the wife, and just write the. You don't need to write the detail. Just write auditory and visual hallucination, because you're writing to a doctor. Okay.
Okay, doctor.
I will not say wrong, but just use the medical term. Okay, you're writing to a doctor. Okay. Appetite and not eating for 7 days. Just we can write insomnia and loss of appetite. These things normal. Current weight is this. Okay. You have not written the weight loss. This was the most important thing. Trust in life. So what you are doing is you are just writing. You are taking the one sentence. You write into one sentence. You are not organizing. This is not good. Okay. As I have explained. Okay. So here is your social history. Is married, okay, to Anna Malkova, 73-year-old, okay. He was admitted, okay. So stops. He needs to administer. No, he needs to be administered, okay. But this is not need to be administered. He was already administered, okay. He was administered. That you have already done. You are not asking the reader to do this. It was already done by you, okay. Kindly call, the reader will not call for this. Okay. This is wrong. You will do this and you don't need to inform the reader. Okay.
Okay, doctor.
I have already explained these things. So
yes, doctor.
Overall, we need a lot of improvement, please. Okay. I will keep this letter at C grade. It is not to discourage you, just to tell that we need improvement. Okay. Please don't worry.
You.
Okay. Thank you.
Thank you, doctor.
Miss Abida. There, Miss Abida. Miss Beatrice. Miss Beatrice. No. Miss Sadaf.
Yes, sir.
Miss Sadaf.
Yes, sir.
Okay, thank you. I'm going to refer Miss Martin. 60. The hyphens are missing here. Please use hyphens. Okay, who was brought by the daughter with the complaints. This is not important to write daughter at the start and the purpose. It is not too important to write he was brought by daughter, and okay. We don't need to write all the symptoms here. We just need to write the main diagnosis here, please. Okay. Sure. This is not a follow-up care. This is not discharge letter. This is a referral letter. Okay. His family history: his wife has dementia, pneumonia, and breast cancer. She was admitted at care home 2 months ago. 2 months with S due to her deteriorating dementia. So after purpose, you have not written the main and important today's visit. Okay.
All right.
Initially present dysuria and nocturia. Here water sample normal. However, you diagnosed UTI. Okay, so now it is however here just and he was diagnosed this symptoms daily was given. The symptoms were improved, and while he still had feeling of isolation due to his wife's condition, exercise on daily basis, CBT with the local local distributor was prescribed. So you are using all of these things, and then you are using only one was. This is wrong. Okay, so you need to change the order of your sentence. Examination. He lost his weight over 2 months, and this is not too important. Just write his weight was this and BMI this. Okay.
Yes.
Couple is auditory hallucination. The main low mood and suicidal thought. You are not written the main sentence. Okay. Reveals his weight. Okay. So you have just mentioned the weight and BMI. You have not compared it.
Yeah.
The respirator was given. Okay. So I'm grateful if you could maintain suicidal thoughts and compliance with medication. Overall, it is not a bad letter. I will give you C grade. But I think you have already taken the exam, yes or no?
No, sir, no.
But you are a little bit prepared for the means you are preparing for the exam.
Yes, sir.
This is not totally zero, okay? As
Sir, I was preparing with my friend.
yeah, so it means you are preparing, but still you need a lot of improvement. This is C grade, okay? Low C, okay? Don't
Sir,
worry,
sir,
it is not to
I was
discourage
not
you.
taken any professional classes.
Okay, no, don't worry. Just with a lot of discussion that we have done, you should a little bit know where we need to improve, how to improve.
Yes, sir. Thank you.
So, Mr. Amos, are you there?
I'm here.
Okay, thank you. I'm writing regarding Mr. Okay, you don't need these brackets. If you want to mention the age, write age without bracket, okay? Comma, a
Okay,
63-year-old, okay? Just write NHS manager. You don't need to write the complete NHS, okay? NHS manager is in.
okay.
Doctor, we just need to write the main here diagnosis, okay? Here is your urgent assessment and management plan, okay? He would require, would look better. On today, no. Just today. On today, no. Just today.
Okay, sir.
He, you know, we will use name of the patient as start, okay? He was brought to clinic by a doctor with complete auditory hallucinations. Okay, if you write it to a doctor, doctor know that auditory hallucination means hearing some voices, okay? You don't need to write these brackets, okay?
Okay,
And
sir.
even
Okay.
you don't need to write this, what the visual hallucination. Abida, okay, okay, Miss Abida, okay. Unremarkable, okay. So his vitals were unremarkable, but he decreased weight 9 kg. This is 9 kg, 13 kg.
So 13 kg. Okay.
Yeah, BMI is written
And I
wrong
have also
also.
BMI.
BMI is
Okay, sir.
cannot. Oh, he take any food versus. Okay, you are not organized, as I am explaining for the last long time. Okay, so you need to organize.
Okay.
Our examination we can write there. Okay, he was looking depressed. This is not on examination, depressed. Okay, and
Okay.
this is not performing. So you are writing under examination. He was unable to perform activities and these things under examination. This is wrong.
Okay.
Yeah, okay.
Okay, sir.
So he was managed. Okay, this and that. Mr. has a history of this and that. Okay, bunectomy, COVID-19, these UTI, these things are not needed. Okay, please.
Okay, sir.
All of these things are.
Okay.
He was also increased alcohol consumption. He was increased alcohol consumption grammatically wrong. There are a lot of grammatical mistakes in your letter. Is admitted, was admitted, is admitted, was admitted.
Okay, sir.
Because, cause, no, this is, you are not writing text to a friend. Cause, no, because.
Okay.
This is the language with friends when we chat, cause. But
Yes.
here is because, okay.
Okay.
Feeling there's not control household question. Okay, so I will keep this letter at C grade.
Yes,
And
sir.
we need a lot of improvement.
Okay, sir.
Paragraphing, language, tenses, all of these things. Okay.
Okay, sir.
Dr. Laila is there.
Thank
Dr.
you.
Laila,
Thank you so
anywhere?
much, sir.
Thank you. Dr. Laila. Dr. Laila. Dr. Nadeem, don't worry. You will improve with time. Dr. Laila is there? No? Dr. Aman? Dr. Aman? No? Dr. Aman is not there? Dr. Aman, Dr. Laila? No? Okay, Miss Abida, number 24. Dr. Aman is there? Is Dr. Aman? Okay. Okay. Okay, so Dr. Aman, this is your letter. Let us count your words. After purpose, when I see today's visit at the end, I get too much happy because I know this will not be a B grade. Okay. You can see here this word today at the end. You can see this, all of you. So once you see this today at the end, it means it is not B grade. Okay. So don't worry. You don't need to take tension. Another driver from Miss Martin, assistant or manager whose clinical feature are consistent, far no off with is commonly used. Your further assessment management would be highly is commonly used. Lives alone as non-smoker. Lives alone. Thus you are not joined these two things with anything. Okay, just put comma at least. Alcohol intake has been increased over the past 2 months. His wife was diagnosed with dementia in 2000. Initially on this represented with return infection. Therefore, this is not needed. We don't need to write a paragraph for UTI. Okay. This is presented with a complaint of feeling lonely and was unable to manage his household. He had lost 2 kg of weight. In how much time? 2 kg weight in 2 days is too much, Dr. Ahman. This 2 kg weight is in 2 months, and that's why it is not too significant. Okay. Once at night, and was prescribed to him, and exercise was. So you can see exercise and cognitive therapy. There are two things, and you are using the verb was. This is wrong. Okay, this is wrong. Has worsened. He was experiencing retrieval hallucination. In addition, he has suicidal thoughts. He was taking orally for the past 7 days. He has lost weight and his body was indicates this. You can see this is good. Okay, Dr. Amon has done well. Therefore, okay. So how many medication are here, people? All of you. How many medication are here, Dr. Amon? How many medication are there?
One
medicine.
given.
Two.
2 medications. So what we should add? Was given or were given?
Were given.
Were given. Very good. Okay. Very good. Okay. So let us I would be grateful. Okay, Dr. Rahman, overall your letter is good, but I will keep it C+. But you can easily get B grade easily if you improve your paragraphing, order of importance, some grammatical mistakes. You can easily get B grade. Okay. So people, what do you think? Any question?
Hello, sir.
Thank you, sir, for your time.
2 hours and 30 minutes, 36 minute class. Wow. Almost 3-hour class.
Thank you, sir.
So any question?
Sir, regarding the spelling of drugs, first letter, is it capital or simple, sir?
Which one?
Regarding mentioning of a drug's name, in this case, risperidone, first letter,
No,
is it capital or simple?
generic names of medication are written small. Generic names like paracetamol, like atorvastatin, like diazepam. Okay, written in small. And brand names are written in capital. This is not a big mistake, but commonly we write like this.
Usually it should be capital letter, no?
Generic name small and brand names capital. Okay.
Brand
You will
names
write
capital.
Panadol.
Okay, right.
Panadol you will write small or capital?
Panadol is a brand name, so
Yeah.
it should be in capital letter.
Very good. All the capitals only P capital.
B capital. Only P capital.
Only P capital. Okay.
Yeah.
So atorvastatin is the generic name. Lipitor is the same medication. Just we call Lipitor in UK. So what you will write? Lipitor capital or small? Lipitor is brand name.
Okay, then it should be capital, sir.
Capital. And atorvastatin?
Atorvastatin is a generic name, sir, so it should be
Small.
simple.
Yeah, good. Okay. If you are not sure, not any big issue, especially for nurses. Okay, but if you know common things, that would be better. Okay.
Right, sir.
Any other question?
Yeah, I have a question.
Yeah, please.
Can you hear me? Okay. Concerning the conclusion, is it a must to put contact me if you need further details at the end of this?
Sorry, I didn't get your question.
Is it a must to write contact me for further inquiry or for further details?
Can
at the
anybody
end of the
explain me her question? Can anybody?
Doctor,
Yes.
she is asking you the last thing. If there is any query, don't hesitate to contact me. Is it
Yeah.
important in all letter?
Yeah, is important. Is important. You should write because this looks
Closing
good. Okay, this is just
salutation.
structure. But remember, this is not included in the word count. Okay, your word count would be like this. Okay, starting from I am writing until would be appropriate. This last paragraph is not included in word count. Okay, so this student's word is 212. Okay, this is not included in the word count, but this is just part of the structure. So it would be better to use it, write it. Okay, and I'm not sure you will lose marks or not, but it's good to write it. Okay. Any other question?
Yes, I have one question, doctor.
Yes, please.
What is the difference between like was diagnosed and has been diagnosed?
Was diagnosed, have been diagnosed. Okay. So if for example, I have diabetes mellitus, okay, DM, okay, and diabetes mellitus, okay, and I just say that it was diagnosed in 2005, okay. So how you will write? Mr. Che was diagnosed with diabetes in 2000. Something that was in the past, okay, only in the past. So is was diagnosed. What about the other question? Has
been diagnosed.
No, this is just I was diagnosed in 2005, okay. No, you want to say that I was diagnosed with diabetes in 2005, okay,
Okay.
in 2005, and still I have diabetes, okay.
Okay.
Still I have, okay. So how you will write?
Dr. Che has been diagnosed with.
Then what you will write? Since or in?
Has.
Since
Had has.
2000. Since.
So how you
He
will
has
write?
had diabetes mellitus for the.
Yeah, you don't need to write that. Need
He
to calculate.
has
Start
diabetes
calculating.
since 2005.
Yes, he has had diabetes since 2005. Okay, this is okay. Or he has been diagnosed with diabetes mellitus since 2005. Now is since, okay. Since is from that time till now. And was diagnosed is just he was diagnosed with in that time, okay, in 2005. Any other question? Since and over, I don't know, Dr. Amman, what do you mean? Who is Abby Khan? Abby Khan. Abby Khan. Who is Abby Khan? Where is your letter, Abby Khan? Abida? Miss Abida? Is this? Okay, any other question before I mark one letter? Any other question? Abby Khan. Who is Abby Khan? This Miss Abida, yeah? Any other question before I mark this letter, please? You can ask me any other question.
No, doctor.
Okay. So Miss Abida, here you don't need this the word date. If you're writing this word date, it means you are too new to OET, I think so, okay? At the start we write these things, okay? Please mute, other people, please mute, okay? Okay, I'm writing to transfer this. You can write, I'm writing to refer into your facility who has recently been diagnosed, with different cycles. He would require his applied language, was presented to our services with low, was present, you should write was presented by his daughter, okay, if you want to use passivize. Lack of interest in routine activities along with suicidal thoughts, okay. So this is not complete today's visit. You should write start with today, then write the complete visit. Okay, this is not complete. You just written 1 or 2 things. Okay, you have not mentioned all the important things of today's visit. Okay, UTI on this date. Afterward, he was in isolation. Okay, all of you can see this sentence. All of you can see this sentence.
Yes.
How long is this?
Yes.
Almost half of the
Long.
paragraph. Almost half of the paragraph is one sentence.
Mm.
It would make it difficult for the reader to understand. Okay, we can start a new sentence from here. Okay, and even we don't need to write about these UTI and these things. Okay, no patient is feeling better if feeling it hard to perform. This is not, you don't need to use this language. If is had difficulty, patient, no, we don't use patient. Okay, no, he has difficulty in performing his daily activities. He was commenced on this and that. The local counselor did exercise or advised. He was talked. Okay, this. No, on his follow-up, his symptoms, he was worsening. Okay. This should be somewhere within today's visit. Okay. Okay, so I am tired. Okay, so your letter is Miss Avida is C grade. We need a lot of improvement. Okay, but don't worry. Some sentences are very good. You just need a little bit more improvement to get C plus. Okay. So any question? So please, next time when you send me letters, whenever it is over writing class with letters, you need to send your names. Okay, like this. Okay, Dr. Satish. Okay, Sivaji. Okay, like
Okay,
bracket
sir.
you can nurse Dr. Hira, Dr. Rabia, Dr. Kenancy. Okay, like this. So then I will give numbers when you send me. The numbers are given when you send me. So first letter was written by Dr. Fayaz, then was sent me Dr. Haynes and these things. Okay. So was interesting class or not? 3 hours class, interesting or not?
Very interesting,
Yes.
sir.
Have
Very interesting.
you taken any paid class for 3 hours with any tutor, OET tutor?
No, never.
No, never.
Just
Not yet.
just you know, just talking about writing for 3 hours.
No.
No.
Okay, I used to mark letters with my students, and when I'm marking for my students, it cannot be too quickly like this when I'm doing with you, because you know here is a little bit quick, because I explained
Yes,
many
sir.
many things at the start. When I'm marking for my students, I mark one word by word. Okay, because they pay money. Okay, money, so they need some quality. Okay. Anyway, thank you so much. Please don't. One more thing, please don't text me if I send you any message that I will be having one class and text me here. This I am asking new students to join the groups in which you are already there. Then don't send me message that I am interested to join, please. You will get the link there. Or but when I send any message on my Facebook page, okay, this is my page. Just when I send any message there, please write in the chat, just write something interested, good, okay, like this something. When there are a lot of comments, then it looks good. Okay, thank you so much all of you. If you have any questions, you can ask me on WhatsApp. Thank you so much. Please invite
Thank
your
you, sir.
friends for the next, whenever we have next class, invite your friends. Okay, please.
Sure.